Hello everyone. So this is agricultural poisons part 2. In this slide we will discuss about the carbamates, organochlorines and aluminum phosphide. Now first we will discuss about the carbamates. Now what are carbamates? Carbamates are derivatives of carbamic acid. They are marketed in the form of powders and solutions. Now, they are divided into two types on the basis of their toxicity. The first is highly toxic, that is examples are carbaryl, also known as 7, carbofurane, methomyl, propoxor, also known as Bagon, and moderately toxic. Examples are aldicarb, carbendazime, and trialate. Aldicarb is also known as tamic. Now we will learn about the mechanism of action. The mechanism of action of carbamates are carbamylation, that is reversible inhibition of acetylcholine esterase. Now signs and symptoms. Carbamates, they differ toxicologically from organophosphate. They produce similar signs and symptoms, but the signs and symptoms are less pronounced than organophosphate poison. They are can be also considered as younger brother of OP poisoning. Now, the first, how do they differ is that they will spontaneously hydrolyze within 24 to 48 hours. Okay, and they will also not cross blood-brain barrier. That is, they will not effectively penetrate into the CNS. Now, the treatment part is the specific antidote for carbamates is atropine, and oximes are contraindicated because they produce carbamylated oximes, which is much more potent acetylcholine esterase inhibitor than the carbamates itself. Now in this slide, the second type is organochlorines. What are organochlorines? They are an organic compounds containing at least one chlorine atom. They are also called as chlorinated hydrocarbons. Okay, they are classified into four categories. First is DDT and its analogs, like for example is DDT methoxychlor, benzene hexachloride, BHC. It is also known as gamaxine and lindane, and the third is cyclodienes and their related compounds. Examples are aldrine, coldrene, endosulfane, andrine, that is plant penicillin. It is the andrine is called as plant penicillin because it is active against wide insects. Okay, toxaphane and other related compounds. Example is toxaphene. Now we will discuss about the signs and symptoms of organochlorine poisoning. So they began from within 1 to several hours. There is salivation, extremely salivation, hoarseness of voice, and dyspnea, diarrhea. After some time, there is a CNS involvement, which causes agitation, confusion, seizures, tremors, and ultimately respiratory failure and leads to death. Okay, so these are the symptoms. And in chronic poisoning, it leads to aplastic anemia, leukemia, and liver cancer. So they are also carcinogenic in chronic poisoning. There are various farmers have been suffered from these. Okay, now its action is, it is first stimulated and it is then depressed. CNS is first stimulated. Okay, and fatal dose of DDT, dichloro diphenyl tetrachloroethane, is and chlordane is 30 gram. For lindane it is 15 gram, and for andrine it is 5 to 6 gram. Okay, fatal period is 1 to several hours. And the treatment is the basic general principle of management of poisoning. We have already learned that. And there is no specific antidote for organochlorines. Okay, and a cholestyramine, which is a non-absorbable as a bile acid binding anion exchange resin. It increases fecal excretion of organochlorines, so it is useful in this. Okay, now we will learn about aluminum phosphide. It is a solid fumigant which is used as an insecticide, pesticide, and a rodenticide. Okay, it is widely used as a grain preservative. You have seen some small white colored tablets of sulfose, alphos, or quickphos which are preserved in the grain in households, common households where grains are stored. Okay, so that is aluminum phosphide. So its fatal dose is 1 to 3 tablets, and if it is inhaled in the 4 to 600 parts per million concentration, then it is a fatal. Fatal period is 1 hour to 4 days, and majority die within 24 hours. The mode of action of aluminum phosphide is when it comes into contact with moisture, it liberates phosphine. Okay, and this phosphine gas is a it inhibits electron transport chain by inhibiting cytochrome oxidase enzyme. So it has an cytotoxic action. That means it have its effects on various organs, like in CNS it causes hypotension, shock. In respiratory system it causes dyspnea, cyanosis, and GIT system causes nausea, vomiting, diarrhea, etc. In hepatic system, renal failure, all systems are involved. Okay, so it is a very cytotoxic poison and it causes death, that is cardiogenic shock, by cardiogenic shock, that is most common, by cardiogenic shock. Okay, and it also has a garlicky odor. Okay, can you remember which other poison has garlicky like odor? Okay, now we will learn about the spot test for detection of phosphine, also known as silver nitrate test. The filter paper impregnated with 0.1 normal silver nitrate solution is taken and it is put as a mask on the face of patient, and the patient is asked to breathe in and breathe out for 10 minutes. Okay, if there is blackening of paper, then it indicates a positive test. Okay, so this is how you can test for if there is phosphine poisoning, also known as silver nitrate test. Now treatment for phosphine is, there is basic general treatment is done, like giving stomach washes, potassium permanganate solution, gastric lavage is done, but there is no specific antidote. Activated charcoal is given to absorb phosphine. It is given as 100 gram orally, and liquid paraffin is used. It helps in excretion of ALP and phosphine, that is aluminum phosphide and phosphine. Okay, magnesium sulfate, it reduces organ toxicity. It corrects hypomagnesemia and arrhythmias. And highway hydrocortisone 400 mg every 4 to 6 hours is highly effective. Thank you.